Content of this meeting is being sent to one or more apps. Okay.
We're live now.
Hello, everyone, and a warm welcome. I'm Kathy Haldane, head of the NCD program at FIND. Before joining FIND, I spent nearly a decade working for one of the world's leading blood glucose monitoring manufacturers. I saw firsthand the technical and regulatory complexity involved in bringing these strips to market, but also how too often these systems leave major gaps in access, especially in low resource settings. And that perspective has stayed with me. And it's one of the reasons I feel personally invested in this work, trying to better understand, together with partners, why local manufacturing remains so limited and what it might take to shift that picture. Over the past year, our team at FIND has explored this technically, economically, and practically. And today we share some of those findings, not as a theoretical exercise, but as a call to action. We've seen that local production is possible, but it doesn't happen in isolation. It takes demand, it takes policy change, and it takes people willing to challenge assumptions and reimagine what access could look like. This discussion also comes at an important time globally. As we look ahead to the upcoming UN high-level meeting on NCDs, questions of access, including access to diagnostics, glucose monitoring, and to integrated primary healthcare are central to achieving global targets and building more resilient, equitable health systems. I'm excited to open this conversation and to hear from those working at every level, from lived experience to policy and to manufacturing. I'm just moving the slides and there's a bit of a delay. Here we go. Before we dive into manufacturing, let's step back. And this is fundamentally a question about closing the access gap. Today, nearly 600 million people live with diabetes, 75% of them living in LMICs. And while glucose monitoring is essential for management, access remains severely limited. The Lancet Commission on Diagnostics showed that in 5 out of 6 LMICs, fewer than 40% of primary care facilities have regular glucose testing available. 1 in 3 people have never had their glucose tested. For those who do access testing, affordability becomes the next barrier. Public sector procurement remains limited. Most people must purchase strips out of pocket in the private sector at prices as high as $70 per strip. A recent global survey by T1 International found that nearly 80% of people face challenges accessing insulin or glucose monitoring due to costs, stockouts, or long travel distances. These barriers cut across countries and income levels and reflect broader systemic challenges. At the same time, global production remains highly concentrated. Roughly 80% of glucose strips globally are produced by just a few large manufacturers in high-income countries. LMICs remain heavily dependent on long, fragile, and costly supply chains. But of course, as FIND, we are not looking at this question in isolation. This work directly links to WHO's global agenda under the Diabetes Compact, the Global Diabetes Targets, and WHO's efforts on pre-qualification for blood glucose monitoring systems. I'm very pleased to now invite Bashir Inous from WHO to share a few reflections before we continue. Bashir, over to you.
Thank you so much, Kathy, and thank you for the opportunity. And good morning, good afternoon, and good evening to all colleagues that are with us today for this really important webinar. It's a real pleasure to be with everyone on behalf of WHO and the NCD department, just to not only do opening remarks, but just help us set the scene as we go ahead with this really important webinar. I would ask Kathy if you could just move to the next slide, please. So as the slides are coming up, I thought it's best that we today set the scene not only in terms of the Global Diabetes Compact, but also more broadly within the UN high-level meeting, which is just a couple of months away in terms of the current negotiations that are going on between the various member states, but in September, where the next political declaration will be. And we stand at a critical juncture in the global NCD response. And this slide specifically speaks to the 14 years since the first high-level meeting in 2011, where we built an unprecedented foundation of political commitment. And yet we face this really stark reality that people with NCDs remain the leading cause of death globally, and that 82% of premature deaths are occurring in low and middle income countries. And so on the slide, what I really wanted everyone to think about is that we got NCDs onto the agenda in 2011. In 2014, we started working towards what would targets look like? What does multi-sectoral action plans look like? What are the best buys? That was more the what. But in 2018, we needed to move towards the how. And so what would implementation look like? What would these commitments look like? How does the agenda broaden up? And my message on the slide to everyone is, what will the high-level meeting 4 on NCDs be remembered for? Will it be remembered for a moment of commitments, or will it be remembered for progress rather than promises? So I want everyone to just think about that in the broader setting. Next slide, please. Now moving towards the diabetes agenda and just helping us set the scene for the webinar. In 2021, we had the historic diabetes resolution that were passed by the member states in terms of reducing the burden of non-communicable diseases through strengthening the prevention and control of diabetes. In 2022, we have seen that the prevalence of diabetes has increased to 828 million, which is quadrupled since 1990. And more than half of the people living with diabetes did not receive their medication. And that's important. Half of the people did not receive their medication. Next slide, please. And so one of the things about diabetes is that it is important not only to have global coverage targets, but it's also about how does this global coverage targets fit within the broader picture of improving access to medicines and health products. Specifically for this webinar today, if you look at target number 5, 100% of people with type 1 diabetes should have access to affordable insulin and blood glucose self-monitoring. And so that's really an important thing for today's webinar. Is it's one thing to make sure that you have your medication, but if you don't have the ability to monitor that glucose, that is really part of the problem. So these are two parts of the same coin that needs to be addressed. Next slide, please. And so as WHO we launched the Global Diabetes Compact, and one of the 6 work streams that's really important through the compact is your work stream 1, which is to improve access to diabetes medicines and associated health technologies. Next slide, please. Therefore, as WHO, we believe that it was really important that under this work stream, not only do we engage with the private sector to ensure that we can get better commitments from industry to improve access to insulin and to blood glucose monitors, but also to set up programs like our pre-qualification program, not only for the insulin, but for blood glucose meters and HbA1c POC. And this is an ongoing program which we really want to encourage industry to play a much more meaningful role and get pre-qualified products out there to those who need it the most. We also do work in terms of trying to better understand the supply and demand, and therefore developing a forecasting and quantification tool to be able to bridge and understand what is the amount needed in terms of patients on the ground, how do we address those gaps, how do we ensure we have the relevant financing, and then those who are supplying the products, making sure that there's an efficient way to make sure that the supply chain can bridge the supply and demand. So that's an important piece of work that's continuing to go. We also do a lot of work, of course, in terms of norms and standards and providing technical support to improve access to medicines. We are updating our guidelines on type 1 and type 2 diabetes and various other areas which is really important for the work that's being done within the space of diabetes. Next slide, please. But really, when it comes to the high-level meeting 4, we are working on some key messages that we want everybody to think about. One of it is ensuring affordability and availability, and Kathy spoke to this. Another one is strengthening procurement and supply chains. And the third one is advancing quality and innovation. And under there's many pieces that need to be unpacked, not only in terms of quality assured generics and biosimilars, finding ways to improve ways of evidence-based decision-making and patient-centered models, but also within the space of this work, supporting geographically diversified manufacturing and making and seeing how this could work within the space, not only of strategic procurement, but allowing various regions around the world to have a better understanding of how they can diversify their manufacturing to support the needs of the patients on the ground. And so what are these products that are important? It's one thing to talk about vaccines and the local manufacturing of medicines, but importantly, we need to understand the medical devices and blood glucose monitors part of that. So this is really innovative piece of work that helps us now understand what would it take to actually move this forward. Self-monitoring is so important for your blood glucose. How could this work? What are the challenges, not only in terms of what we saw during COVID in global supply chains, but the economics, the health systems, and the policy integration opportunities as well. Next slide, please. So this is my final slide. And what I'd just like to leave everybody with is, I've just returned 2 weeks ago from the Health Working Group G20 meeting that took place in Johannesburg. And one of the things we were really trying to improve in terms of the NCD response is how to make sure that this agenda is made visible, not only in September at the high-level meeting, but also through the various other platforms where member states play a crucial role. In that meeting that we had at the fourth Health Working Group, thinking of solidarity, equity, and sustainability, we realized that it's really important to work towards operational imperatives. And what does that mean? That means we believe that political commitment exists. We now need to move towards operational frameworks that is not just an aspiration, but being able to bridge these commitments and strategies into ways that can actually improve access on the ground. And so we need to build those support systems. We need to transform how these pharmaceutical supply chains and device supply chains look. But it's also no more a question of whether we committed to access, but if we committed to making access possible. And so this is a 1-year timeline of how we hope to improve the operational framework to improve access to medicines and health technologies, which include blood glucose monitors over the next year. Once we launch this operational framework as WHO, we really hope that the work that has been done through this really important initiative by Find and partners, can really have an opportunity to move forward in a way that ensures that everyone has access to the products they need, no matter about where they live or their background. Kathy and colleagues, I really thank you on behalf of WHO for this opportunity to be with you today. And I really look forward to the webinar and all the speakers ahead. Thank you very much.
Thank you, Bashir, for highlighting the critical policy context for this work, of course, and also for setting the stage so clearly. Before we move into the findings from our work, we want to ground this conversation in the lived experience. Behind every statistic, whether on access, affordability, or supply, are individuals living with diabetes and facing these challenges every day. I'm very pleased to welcome Anita Savidi, a person living with diabetes and advocate, to share a few reflections and remind us why this conversation matters. Anita, over to you.
Thank you so much, Kathy. Hello, everyone. Thank you so much for giving space to voices from the community. It's truly an honor to be here today. Next slide, please. The human impact of access to glucose test strips. I'm showing two of my organizations, ICADER and Bersadia. Next slide, please. Yeah. So my name is Anita Savidi. I've been living with type 1 diabetes for more than 27 years, diagnosed as a teenager, long before we had smartphones, CGMs, or social media to connect with others like us. I'm also a patient advocate based in Indonesia. And over the years, I work closely with diabetes communities across the country, from major cities to rural islands where health services are sparse and diabetes is still heavily misunderstood. Through this experience, I've come to understand that access, it's not just about availability. It's about affordability, awareness, and dignity. And today, I want to talk about something that's often overlooked in national health discussions, glucose test strips. As you can see, I put an image. So back in 2022, we started a petition for glucose strips coverage by our national health insurance for people with diabetes. Next slide, please. Okay. Why glucose strips matter? Blood glucose test strips may seem like a minor tool, disposable, simple, and small. But for people with diabetes, especially those using insulin like me, they are life-saving. They are our daily guide, helping us decide how much to eat, how much insulin to take, whether it's safe to go for a walk or if we should rest. Without them, we are navigating in the dark. We don't just lose data, we lose safety, confidence in ourselves. Imagine if a person with high blood pressure had to guess when to take their medication based on how they felt. Or if someone with asthma waited until they were short of breath before using an inhaler. That's exactly what happens when someone with diabetes can't monitor their blood sugar. And unfortunately, that is the reality for millions of people in Indonesia and other LMICs. In many public hospitals and health centers, strips are either not provided, not available consistently, or limited to a few per month, far from what's needed to safely manage daily life. Some families have to choose between food and test strips. Others ration them to 1 or 2 tests a day, or skip testing altogether unless something feels very wrong. But by then, it can be too late. Next slide, please. Indonesia is a vast and diverse country. We are a nation of over 17,000 islands with different healthcare facilities in every province. In cities like Jakarta or Surabaya, you might find private clinics that offer strips, but they come at a cost many cannot afford. In remote areas like Eastern Indonesia or small islands, even basic health services are limited, let alone access to diabetes supplies. What this means is that access to glucose monitoring is inconsistent, inequitable, and often invisible in public health screening. Many health workers in primary care settings are not trained to support patients with type 1 diabetes. Insurance coverage, like our national BPJS system, not include strips. and education on how to use them properly is minimal. Families are left to figure things out on their own, relying on Facebook groups or WhatsApp chats for support. And when someone is hospitalized due to complications that could have been prevented with proper monitoring, the emotional and financial cost is enormous, not just for the person, but for their entire family. This is not simply a medical issue, it's an equity issue, a human rights issue, and a development issue. Next slide, please. Let me share what I've witnessed and what I've lived. I've spoken to mothers who divide one test strip between two children. I've seen teenagers lie about their numbers because they didn't want to burden their parents with the cost of extra strips. One young man in his early 20s told me, "I only test when I feel something is wrong. Otherwise, I just guess." He works as a delivery driver, we used to call as Gojek driver, riding his motorbike through busy streets with no idea if his blood sugar is dangerously low or high. I also have a case in my community where a mother shared her concern that she's running out of strips and she lives in a remote island. And unknowingly, we respond to find the nearest pharmacy. And her answer shocked us when she said it took a night by boat to reach the nearest island that has pharmacy, which means that she should stay for a night without strips for her child. This isn't a story of neglect. It's a story of a broken system, of gaps in access and education. These are people who want to care for themselves but are blocked by barriers they did not create. Beyond the physical health risk, the mental health toll is severe. Living with diabetes already comes with a heavy emotional load. Add to that the anxiety of not knowing your blood sugar number, the fear of going to sleep and not waking up, the stress of affording supplies, it becomes overwhelming. Next slide, please. And what happens next? Missed school days, missed work, missed opportunities, all preventable if we just had access to this one basic tool, test strips. Next slide, please. That's why I'm incredibly encouraged by this project exploring local manufacturing of glucose test strips. If we can reduce our reliance on imports and build local capacity, we open the door to more affordable, sustainable access. It means we can price products with local economies in mind, reduce supply chain gaps, and respond more quickly to community needs. Next slide, please. But we must ensure that affordability goes hand in hand with quality. Cheap but inaccurate strips can be just as dangerous as no strips at all. And access also means distribution, getting strips to rural areas, training healthcare workers, and making sure people know how to use them properly. Crucially, we need community involvement at every stage, from design and testing to packaging and delivery. Because people living with diabetes are not just end users, we are co-creators of better solutions. Next slide. In closing, I want to say this. Glucose test strips are not just tools, they are keys to freedom, to opportunity, to safety, and to a better future for millions of people with diabetes in Indonesia and beyond. Improving access to them should not be seen as a nice to have. It should be a public health priority, because when people can monitor their health, they can take charge of their lives. Next slide. So I urge all of us, manufacturers, policymakers, advocates, and allies, to keep listening to the community, to work with us, not just for us, because no solution will be complete unless it includes the voices and realities of those who live with this condition every single day. Thank you so much for the opportunity to share today, and I look forward to continuing this dialogue together. Thank you so much, Kathy.
Thank you so much, Anita, for sharing your perspective and really reminding us what's at stake in this conversation. I'm going to move on now before we dive into the technical findings, we'd like to hear from all of you. So access barriers can look very different depending on where you work and the context that you see. So to help frame today's discussion, we'd like to start with a quick interactive poll using Mentimeter. So if you can scan the QR code on your screen or go to menti.com and you then have the code over there. Our first question is, what is the biggest barrier? Sorry, let me just quickly open up the Menti while you are logging in. What is the biggest barrier to blood glucose self-monitoring in your setting or in LMICs? So there'll be 6 options that'll come up on your Menti. Great. Yeah, high cost, lack of understanding among people with diabetes, lack of awareness. Wow. Great. I'm going to move on to the next one, really, because once again, I think what is showing, I know it's only a few that have already posted, is the high cost of strips and meters, coupled with the lack of awareness among people with diabetes. I think speaking to the capacity aspect as well, that Anita highlighted. We have another question, which we really love your input on as well. And the second question, also in Menti, should be coming up, is what is the biggest barrier to local production in your setting? What is the biggest barrier to local production of glucose strips in your experience? Is it the lack of financing or investment, weak government support or policies, expensive, complex technology setup, limited market size or demand, competition from international brands, supply chain, raw material challenges? Seems to be across the board mainly. Okay, competition from international brands coming up quite stronger now. Okay, lack of financing and investment and competition from international brands are competing for space there. Thank you so much. Thank you for contributing towards this. I think it frames our conversation really well, going into our findings. So the conversation really builds on important global momentum as well. And in recent years, as you are aware, 2 of the largest insulin manufacturers have partnered with African producers to localize insulin manufacturing. And as insulin access expands, demand for glucose monitoring will only increase. But for blood glucose strips, it's far less clear whether similar local manufacturing models are viable. And that's the question we set out to explore. Over the past year, we've mapped the manufacturing landscape, analyzed cost drivers, and engaged with manufacturers across several countries to understand both opportunities and barriers. And to lead us into these findings, I'm very pleased to hand over to Jide Fowler, who has worked closely with Find throughout this project. Jide has led much of the deep dive analysis into market dynamics, production costs, and real-world feasibility. Jide, over to you.
Thank you very much, Kathy. So yes, in line with the context that has been shared, over the last 12 months or so, we embarked on the task of answering the questions around the feasibility and sustainability of blood glucose strips local manufacturing. Basically, we're trying to answer the question of, can it be done in LMICs? Who is doing it and how are they doing it? And if the question was yes, there are people and players already doing it, does local manufacturing improve affordability and access barriers and ensure that strips are getting to the people that need them the most? So these are the key insights that we found over the course of the project, from speaking with experts, from speaking with large international manufacturers, as well as regional manufacturers who are all producing strips. We spoke to NCD experts and consultants. And then we also had an advisory committee that was steering our conversations. So going into the slides, so this is the global manufacturing landscape. And basically the information that we're sharing here is that we did not find a lot. Very early on into our research, it became apparent to us that there was no correlation between the prevalence and incidence of diabetes and the presence of local manufacturers. It was concentrated, and we found that there was very few manufacturers present in LMICs. We also saw that it was largely dominated by the Big Four. I understand that some of these logos might be small on your screens, but the Big Four is basically Roche, LifeScan, Ascensia, and Abbott. These four companies control majority of the market share. And it also creates an interesting dynamic because of the closed system of blood glucose strips and the glucose meter. Switching is difficult, which means the products are sticky. So if you're already familiar with a certain brand, there's a tendency to stick to it, whether or not there are cheaper alternatives available. We also found presence of a lot of mid-tier companies. We used the term mid-tier not because they don't have the capacity to match that of the Big Four, but basically it's they are struggling in the competitive space in comparison with the Big Four. And we also found a handful of regional manufacturers who are successfully producing strips in their home countries. Moving on to the next slide. So this is the flow chart or the process of producing strips. It starts all the way from electrode preparation all the way to cutting, bottling, labeling, and packaging in preparation to be shipped out to the market. By default, if you're doing this, this is referred to as end-to-end full process manufacturing. And to do this, you would need a fully automated manufacturing facility because that's the most efficient to be able to handle all of these processes. But what we also found was that there was a situation where if you didn't have the cost requirements or if you didn't have the knowledge capacity or the knowledge requirements to be able to establish full end-to-end manufacturing, it was possible to, via a technology transfer arrangement or partnership, import pre-dispensed sheets and then doing the filling and finishing on site. And that is the process that is referred to as semi-finished, or some also refer to it as semi-knocked down. But as you go from the lower part or towards the tail end of the manufacturing process, if you're backward integrating, it requires more investments, and there's also a lot of complexity. Many manufacturers chose to do this because it allows them to have a better control of quality. But it's also, in addition to increasing the capacity, it also allows them to reduce the cost of goods. On the other side, there are different product formulations that allow you to play around with the strips that you eventually introduce into the market. Sometimes it's determined by the market, sometimes it's determined by the desire to want to reduce costs. For example, we found in many markets that the preferred enzyme was glucose dehydrogenase, because that was what the market was generally used to. But if you're choosing between carbon and gold, if you're choosing between glucose oxidase or glucose dehydrogenase, or different mediators, then it will lead to a more expensive product. Moving to the next slide. So this slide basically confirms everything that we know about economies of scale. If you want to have stripped down operations, with the help of an external consultancy, we were able to find out the estimated cost of establishing manual, semi-automated, or fully automated operations. The cost capacity trade-off is apparent. And in addition to that, the graph that would come out on the other side of this slide shows how significantly lower it is to invest in fully automated production. Manual has less capital requirements, but your cost of goods will be multiple times higher in comparison to fully automated production, which requires a lot more capital investments, but allows you to have cheaper cost of goods on your strips. So this answered our feasibility question. Can it be done? Yes, because we did see, I might have mentioned, but our work took us to 4 sites over 3 countries, and we did see a variety of manufacturers mixing up their product mix with varying degrees of automation. So the answer to that question, can it be done, is yes. But the deeper question, if we were to go several layers lower, is can it be done sustainably? And this leads us into the question of demand. So on this graph, you see certain acronyms. So the total addressable market is basically how big the entire market would be if everybody was tested and they knew about their diabetes status and they were using strips as frequently as they need to be. And the serviceable addressable market is basically the people that have tested, and this is the reality of things on ground in these countries. Basically, this is the current market scenario in these countries. And you can see that there is a large gap between what the total need is and the serviceable available market is. And in the 3 countries that we visited, Indonesia, Nigeria, and Algeria as well, but Kenya is on this graph. They have healthy CAGRs to project that by 2030, their markets will be growing significantly. But even with those CAGRs, it still doesn't come close to the total need if everybody was using strips as they were meant to be using it. Moving to the next slide. And this then comes back to the question, why? And this has already been addressed by some of the previous speakers. The challenge is a lot of people who use strips are paying for this out of pocket. And there is a financial decision regarding this. You're deciding, between other medications. Sometimes they're deciding between food and other bills. And because of that, there's strips rationing, which has also been mentioned. You're not testing the ideal number of times. There's little public sector engagement as well. But essentially, the reason for this is the cascade of care. The gap in that is basically because there's a large out-of-pocket paying market, and a lot of this demand is also very fragmented. In addition to this, there is also a large dependency on importation. As mentioned earlier, there is a preference for international brands. And sorry, if you can click on the slide to bring out the other side. So there's a bit of a lag. Yes, so there is a dependency on importation, where in Kenya, for example, 100% of the strips that they use there are imported. In Nigeria, it's 95%, and in Indonesia, it's 85%. But basically, the summary of this slide is more than 75% of the volumes of blood glucose test strips are bought out of pocket. So this creates a difficult environment for local manufacturers to be able to properly plan and justify the cost of the investments in strips. So based on the questions that were raised in the Mentimeter, around what the barriers to access to strips and barriers to manufacturing strips were. We observed all of these challenges in the markets that we visited, and we have synthesized all of them into three broad areas. On one side, the market and demand showed us that in markets where there's insufficient or fragmented consumer demand, it's difficult for the local manufacturers to properly plan production, properly plan their raw material sourcing. It doesn't justify, the high amount of investment and high cost that it would require to establish production. You also mentioned that there's a need for awareness and education. This was also something that we have observed while we're visiting the market. There are a lot of people who are not using strips the right way. An anecdote that was shared with us is many people tend to leave their strips by the television set, and the heat for the television then damages or affects the reading on the strips, which then leads to false readings. So there's an awareness gap that needs to be addressed. With regards to operations and supply chain, raw material availability is a challenge because many of the sourcing has to be done from the east, which then creates a lag. There's minimal order quantity challenges as well, which basically means if you are engaging in a technology transfer partnership, there's a minimum number of pre-dispensed sheets that you can buy. But there's no guarantee that you're able to actually push that into the market, which is another challenge. There's also a technical expertise gap. Basically, for other manufacturing sectors, it's easy to approach and poach other staff from other companies. But for many of the regional manufacturers, they are the sole manufacturer in many of their countries, which then means it's hard to recruit people. There's a lot of money that has to go into training people. And on the policy side, there's a need for government support in terms of incentives, in terms of stable fiscal policies, which then allows investors to borrow money to fund and invest in local manufacturing with the certainty that they are able to generate enough to cover this. And then support from the government as well in terms of encouraging awareness and testing. So this is a broad synthesization of our findings in terms of how sustainable manufacturing requires movement across markets, supply chain operations, and policy. So as I mentioned, before I hand over to Sarah, we visited three countries, and I understand that this slide has a bit of information to digest, but I would point you to the key things that you should note. It's details sizable markets where ordinarily strips consumption should justify the establishment and the presence of local manufacturers. But it then also highlights varying levels of government support. It highlights variable levels of national and social reimbursement schemes. And then it also highlights the percentage of the market that is paying for strips out of pocket. And with that, I would like to hand over to Sarah to go into the panel discussion around the deep dive on these countries. Thank you.
Thank you so much, Jide. Sarah, I'm not sure if you're able to unmute. You're not able to unmute. Oh, it's wonderful to have these technical glitches. It's all good. So if we can move on with the next slide. And while Sarah is working on her technical aspects, if I can just ask for the slides to...
Here I am.
There we are. Wonderful. Thanks, Sarah. Over to you.
Thank you, Kathy, for stepping in and seeing my despair and trying to unmute and just seeing everyone waiting for me to step in. So apologies for that delay. I'm Sarah Freuder. I'm the head of market innovations and industry partnerships at Find, and I've been working closely with Jide, Kathy, and the team on this work. Based on what Jide just shared as key insights from the project, and also by setting the scenes here of 3 countries, the reason we were addressing these countries is that we had the pleasure to visit 3 manufacturers in the countries that have decided to make this journey, to take the journey and start to produce glucose strips locally. And the best way to go further into details about what Jide just mentioned is to give the floor to the people who are really doing this. And that's why, if I still have technical issues, if I manage to, there it is. I have the honor to have 3 people with me, 3 persons here with me today for a panel discussion on local manufacturing feasibility. So we have Zubair Tablul from Vital Care Algeria, Mary Ogongu from Codex Group in Nigeria, and Erwin Hermanto from CHC Indonesia. Erwin, when it's your turn to introduce yourself, you can give the full name of CHC, but we've made it shorter. And before we go into the panel discussion, I would like to give the floor to each one of the panelists for a quick introduction to share but when you started this journey of glucose strip manufacturing, where you stand today, just to give an idea of where you are on this journey. So maybe Zubair, over to you to start with.
Yes, hello everyone. Zubair Tablul, Managing Director of Vital Care. We are leading manufacturer of glucose strips in Algeria. We started the journey the company has been created in 2016, but we started our journey for manufacturing in 2017. After 6 months of studies, we launched the orders for machinery and land premises, buying land premises and so. And we started really the construction in early 2018. And by the end of the same year, we started selling this strips in local market in Algeria. We started in uncut sheet as first stage, but in parallel, we were progressing in completion the full process integration. And 4 months after launching the uncut sheet sales, we launched also the uncut sheet sales. The fully manufactured process sales, meaning in the first quarter of 2019. Our capacities are 2.6 million vials of 50, meaning roughly 130 million strips per year with 1 shift. Now we have a capacity. We are running 3 shifts. Then we are roughly doing 400 million strips per year. That's it. Thank you.
Thank you so much, Subir, for sharing this. Maybe Mary, over to you for your introduction.
Yeah, hello everyone. This is Mary Ogangu I'm the CEO for Codex Group as the Chief Operating Officer. And I'm here speaking on behalf of my team in Colexa Biosensor. Colexa Biosensor is a part of a broader group under the Codex brand. And it's our first facility towards our backward integration drive. It started operations in 2023, October, following incorporation in 2017. And as part of the backward integration drive, we're also looking at introducing other facilities, the second of which was launched in May 2025 this year. But with regards to Colexa Biosensor, it is located in Lagos, Nigeria. It was set up as an IVD medical device manufacturing facility, and today it produces blood glucose test strips and assembles meters. We have a total capacity of 3.6 million packs of strips. That's 180 million tests across 3 shifts per annum. Of course, we are still very far from those numbers, but I believe that's why we're here today. Processing commences from uncut sheet. And of course, we started up this venture as a technology transfer, setting it up here in Nigeria. And so we bring in the uncut sheets and we assemble the meters. To date, at least between October 2023 and today, we've sold a total of 500,000 packs of strips. And I think this also speaks to some of the findings that have been shared with us by Jide earlier. But thank you very much for the opportunity to introduce Colexa Biosensor Limited.
Thank you so much, Mary, for this introduction and explaining where you are on this journey. The last, but not the least, panelist that we have with us is Erwin. Erwin, over to you to give an introduction of your company and activity.
Thank you very much, Sarah, and thank you everyone for the opportunity to speak today. My name is Erwin Hermanto. I'm the Managing Director and the owner of PT Cahaya Hasil Cemerlang Multi Manufaktur. You can just go with CHC, as Sarah mentioned. So yeah, so we started off as a electromedical manufacturing company. And in end of 2022, we decided to get into glucose meter manufacturing. So we started off with the assembly of the meter, and then started off with uncut sheets. But we're moving towards actually producing the PCB board locally as well at this point, and also doing the enzyme dispensing for the strips. Yeah.
Thank you so much.
Thank you, Sarah.
Thank you for being here. So I'm just trying to get back. I'm sorry, I'm having technical issues with the slide. I wanted to put back the picture with all of us on the screen, so maybe the fine team can support. Thank you. So now that we have understood that the 3 of you, you're coming from 3 different country settings with different policies, different population size, different out-of-pocket market sizes, as well as 3 different situations in terms of manufacturing setup and in terms of where you stand in the manufacturing journey and in manufacturing capacity. I think that is this variety is gonna make it really interesting discussion when we talk about the enablers and the challenges related to local manufacturing setup. So I would like to start by addressing a question to you, Zubir, about enablers, and especially regarding the role of the government in your company and your company's success. So what role does the government play in your journey, in your success, and more specifically, what policies support local production of strips and really make a difference for your company on this journey?
Okay, thank you. I think for us, the government play an essential role. I mean, it's a fundamental role, which is guaranteeing the market demand. Because of the social security is reimbursing 100% of strips, and meaning every Algerian who is diabetics have the right to get his strips for free. So there is no problem of affordability, no problem of market. A second thing is that the import of finished product strips is forbidden since 2018. Then this is done to encourage local players to invest, not only local players, but to encourage local manufacturing, what with multinationals or with regional players. And the third thing and measure, capital measure also is to a lot of range of incentive to encourage the investment with tax-free for a certain period of years, with subvention, mean help in terms of interest rate for financing, and a lot of incentive also for getting properties and facilitating the registration process. So it is all of them are playing the harmonization between different policies, between Ministry of Health, Ministry of Industry, Ministry of Finance, and Social Security, was depending on the Labor Ministry.
Very interesting. And Mary, you're coming from a different country with a different setting and a different government. Can you share a little bit? Do you agree with some of the items that Zubair just shared with us, or do you have a very different situation in Nigeria?
Okay, I just want to use this opportunity to say it's a pleasure to meet you, Zubair and Erwin. And to answer your question directly, no, this is a very different scenario for us here in Nigeria. But I think it's not all, dark and gloomy. There are a lot of conversations ongoing now pulling us in that direction. For example, we have the Presidential Initiative for Unlocking the Healthcare Value Chain, shortened PVAC. They've been working very closely with local manufacturers, Colegza included. We've had several engagements, and I would say that most of those engagements with them brokering, the conversations with the Federal Ministry of Health has led to our very first order from the Federal Ministry, and it was a breath of fresh air. But of course, a lot of bureaucracies, go along with that process. It takes time to move, such projects through to the end of the line, and we're still on that journey. There has also been, other supports like waivers with the executive order that was published early this year, allowing inputs to come in at zero duty. And, that's also a very funny scenario we've had in the past, where inputs would come in with a customs duty, but the finished products, the strips, would have zero duty. So there was a mismatch. And we think that has been equalized now with the executive order. So there are a lot of activities going on in the country, and the government is showing interest to support more. But I would say it seems we're still, a long way away from from Zubair's experience in Algeria. Thank you.
Thank you, Mary. So it sounds like you agree with Zubair, what he mentioned about the government role in creating the market and generating the market demand, supporting in that competition with the imported products, and also to support with a lot of different incentives to the manufacturers and to set up local production. Where Algeria, they seem to be well advanced in setting up these three elements, whilst in Nigeria, you're still at work, but it sounds like the government is working on that. And as you said, it's not all gloom. There's a lot of hope and good incentives there. Yes. Erwin, where do you think that Indonesia sits in setting up these three? The Indonesian government is supporting setup of local glucose manufacturing, and also in terms of market market generation, looking at the competition with the imported products and incentives for setting up local manufacturing.
Yeah. Thank you, Sarah, and thank you, Zubir and Mary. Good to meet you both. And and to answer your question, Sarah, I think Indonesia lies somewhere in between Zubir's situation and Mary's situation. So, back in 2022, our president back then, Mr. Jokowi, had issued a presidential decree, out of necessity at that point because of economy recovery needs post pandemic, and he basically had requested all the government entity to procure locally made products with local content higher than 40%. And that has sparked tremendous growth in the health industry. And of course, glucose meter production is one of them. But maybe I should lay out some data beforehand. And the glucose meter market in Indonesia is 55% of government and 45% of private sector. So that's include out of pocket as well. So it's almost split right in the middle. And unfortunately, the regulations can only cover up to the government procurement, but not the private sector. The government had done a tremendous job in sparking the growth, but I think within the last maybe a year or so, we start hitting a wall as well. And partly because the government has yet to stop import. Unlike the situation in Algeria, where I heard just now that the government has stopped import completely, our government continued to let import through. And in some cases, just like what Mary had mentioned, the import tariffs and taxes for the raw material and the finished goods is a little bit off. So sometimes it's a lot cheaper to import the finished good than actually the raw material. So that doesn't quite help in terms of local manufacturing, although we continue to work with the government to inform them so that they can, reconsider some of this import tariffs for the raw materials so that we can be more competitive. Our market annually is about 160 million strips for both government and private market combined. So it is not very big. And I saw Jide slide earlier. To invest in a fully automated line, you can practically produce that with just one line. So it's still quite small. And out-of-pocket market is also quite small. It just consists of 10% of the overall market. So all of this, of course, is a factor of socioeconomy. Even though we have a very large pool of populations, 285 million people, but unfortunately, most of that populations are still living maybe under the line of poverty per World Bank definition. Yeah. So this continues to be a challenge, but I think to improve the situations, we should just focus on import substitution of the existing market, particularly the private sector market needs to be maybe redirected to support the local production because until today, I think the preference for the private sector is still continue to procure imported brand.
Great.
Yeah.
Thank you, Erwin. I'll come back to that last point about private sector market and preference for the international brands a little bit later on.
Sure.
But now, so it sounds like the government has played this role when you talk about Algeria, all the incentives, all the reimbursement, the way they've worked and everything that is set up for the market demand. And what we're hearing also from you, Mary and Erwin, the government does play a critical role in terms of setting the right policies and supporting the setup of local manufacturing facilities. If we turn the story, then we talk about the support and the government role. If we look more to challenges, and maybe Mary, I can start with you this time. When we talk about challenges, what would you say were the challenges that you underestimated when you launched yourself and your company on this journey? Sorry.
Thank you so much for that question, Sarah. So before we even decided to set up Colexa Biosensor. We had been in the market importing a foreign brand of blood glucose meters since 2009. And all through our journey, we learned, realizing very clearly the pain points of the patients. Of course, just like the lady from Indonesia spoke
Anita.
earlier on, yes, affordability, availability, and access, are very important, and of course, quality. So understanding the pain points, we were very certain that in bringing the products, the manufacturing closer to the consumers and ensuring, some level of affordability, we would have a significant initial uptake of our, the products that we're putting out of the facility. But it was a very different story when we eventually started. Now, some of the things we did before I go to the challenges was we understood that quality, is essential to the consumers. They want a brand that they can trust and that they can rely on. Consistency and availability is almost assured now that we have the factory closer to the consumers. But in assuring quality, we went immediately to obtain the ISO 13485 certification, because this was a standard that would ensure our processes are well defined and sustainable to ensure consistent delivery of quality products out of the facility. And so when we went into the field, we went with the agenda of putting this message across the entire country, and Nigeria is really sizable, and of course with the population. So one of the major challenges we had was with manpower. We realized that Nigeria has, some unemployment gaps, and we thought this was an opportunity to bring more people into that space while using, the same Nigerians to promote this high quality brand that has been brought closer to the consumers. But at the end of the day, we were grossly disappointed because the reality of unemployment was not reflected in the number of people that were willing to take this message across to the consumers. So I think part of the challenges there also lies with adoption. A lot of people still prefer the imported brands. While we had put out the message of, the quality they can expect with this brand, there was still skepticism. People wanted to be assured, and the best way for many of them was over time to see that Colexa could provide the strips consistently and in the best quality. So while we had trained our people to pass this message across, there was the resistance from the consumer side saying it's made in Nigeria, there's skepticism, and then from the supplier side, with the people we had in the field, not putting the effort in that regard. The other challenge we had is with multiple regulatory barriers. So we have various levels of regulatory interventions, even for blood glucose meters and strips in Nigeria. NAFDAC is supposed to be our premier regulatory authority, but we have other bodies in between, taking a role to validate this product and assure it and give it an approval. So that's another challenge we had. In addition to this second challenge is the fact that when you go to the facilities to promote this product, even with the reports from the regulators, from NAFDAC and the other regulatory authority called the Medical Lab Science Council of Nigeria, we found that there was still pushback, and every facility wants to validate the product, validate the BGM and the strip all over again. So this was really cumbersome, but we found out that it was the best way to win them over and to allow the adoption of the products in the health facilities. Finally, of course, taxes and levies from various levels of government, but those are things that are currently being worked on. I think recently, just a few weeks ago, it was in the news that Lagos State government is looking at taxes that affect local businesses, and they're trying to ease the environment, present a single tax window to reduce the bureaucracies and the challenges with meeting your tax obligations. But I would say at the top of all of this, has to do with the slow adoption and the perception of the customers, as well as the manpower required to spread the message across the entire country. So thank you very much.
Thank you, Mary. So I think it comes back. We both, when we talk about the role of the government, and here also the challenges that you've faced. I have the feeling we come back to the question of the market. So it's the adoption rate, it's the competition with the international brands, but also that the perception of quality and how you get your product onto the market. So it seems like it's not the manufacturing, the setting up the manufacturing facility and getting that running that is the most challenging. Is that once you have the product in hand, how do you get it to the market and to the patients that really need it? So maybe I'm keeping an eye on the time as well. We just have a few more minutes, but talking about the competition with the international brands. Zubair, with your experience from Algeria, I know that the government took a very strong policy of banning import, but what would your key learnings be about what you need to do as a manufacturer to get a place on the market next to these international brands?
Yes, thank you. I think the right strategy is to build, when we are fighting with the multinationals, to build a strategy based on the quality. And quality, it comes from the right products and the right standards. That's why we did GMP certification, ISO, different ISO certification. We have conducted 2 clinical studies in 2 years. And we had also invested a lot in promotion and field force team to convince physicians and doctors, prescribers to that the product is absolutely reaching the same standards as multinationals. But also let me add something in terms of effort. We need also to, but because of specification of Algeria, in Algeria the meters are not sold. It's given for free. Then one key success factors is to need to invest a lot of meters for free to put them in the field in order to get and to help the pharmacists and the health facilities to provide the strips both with the meters. Otherwise, you will never win in this fight. And multinationals in Algeria for more than 15 years invested a lot of in meters, in putting meters in the market. That's why local players, we didn't invent anything. We did the same, absolutely the same strategy as multinationals, and it succeeded.
Great, thank you. I would love to continue on this, but we're running out of time. And before we close this session, I just would like to address a question maybe to you, Erwin, about if you had a top 1 to 3 advice to the community, would it be the policy makers, the advocates, the NGOs, new manufacturers, advice to ensure that local manufacturing is a success and improves affordability and availability of tests? What would your advice be?
Yeah, I think for the manufacturers, you have to maybe take a closer look on the product positioning because we did get a lot of surprises as we go. Originally, we targeted mostly the government market, but unfortunately, with the way things are set up currently in Indonesia, because of the local content regulations and whatnot, the government had put a very, very high emphasis on price, number 1, and local content, number 2, but quality is not really in the consideration whatsoever. And that had somewhat caught us by surprise because we had set up our manufacturing, putting quality first and everything else second. And I think naturally that's what most manufacturers will do as well. So that caught us by surprise. And in the private market, we're somewhere in between, in the middle of nowhere, where the private sector who can afford the European or American brand, they prefer to get the like of Abbott or Roche and any other brand, and the one that maybe opted for cheaper price, they would go for the Chinese brand. So I think market positioning is very important, and that needs to be a priority. And then I think the future local manufacturer need to be looking into that very closely, especially for the Indonesian market. Thank you, Sarah.
Thank you, Erwin. And thank you, Mary, Erwin, and Zubir for sharing so openly your experience and your insights from your journey. It would have been really interesting to continue this discussion, and I'm sure we will take that offline and people will reach out to learn more from what you have done so far. Now we've reached the end of this panel discussion. I would like to give the floor back to Jide to continue. He previously talked about the feasibility of local manufacturing, and now moving on to the second question, meaning how and if local manufacturing can improve affordability and accessibility of glucose test strips. The floor is yours, Jide. Is Jide experiencing the same thing as me and he can't unmute? Right. Yes. Comms team, can you help us to unmute? There.
Okay,
Good.
thank you. Yes, so following the panel discussion, we'll be talking about how our conversations and our findings, answer the question about how local manufacturing impacts on affordability and accessibility. So in one of the countries we visited, we found that a local manufacturer was able to produce and sell strips at 17 cents per strip equivalent. And in comparison, on the market in the same country, AccuCheck strips were going for almost twice the price at 32 cents per strip. On this graph, you see that while we understand due to economies of scale and the challenges around supply chain and every other thing that bumps up the eventual cost of goods for a local producer, the opportunity for local production to reduce the incidence of freight and tariffs and margins allows them to be able to retail the strips for much lower. However, there was still a preference for the AccuChecks and the international brands, which is also then confirming everything that our panelists have just spoken to us about. So the markups are, everybody including their margin on the imported strips, which is then leading to the final retail price of 32 cents per strip. And we did speak to one of the international multinationals, and they confirmed that they are aware, and they also confirmed that it's kind of out of their hands, as again, these markups are not directly impacting their bottom line, but they also realize that it is a problem for their products because for the end users of strips, at some point when they realize that there's cheaper alternatives of comparable quality, then maybe there's a shift, and which would then negatively impact their sales as well. So this is something that they are aware of. But in terms of impact on affordability, as much as the local manufacturer cannot match the efficiency scales of global players, it can reduce the cost burden to the end users. And with regard to impact on accessibility, we borrowed from USAID's Healthy Markets for Global Access, their access primer, and they have a framework called the 5 A's of market characteristics, and this was what we used to evaluate the impact on accessibility. I'm just going to bring out everything so that we can see the 5 A's of market characteristics. So there's the availability. Local manufacturing definitely facilitates supply reliability and last mile reach by shortened lead times and more flexible responses to demand shocks. As well as most importers and distributors of strips tend to focus on urban areas. And this is a gap that local manufacturers are able to plug if demand is handled properly. Affordability, as we saw in the previous slide, local manufacturing reduces the imports and markup-related burden and costs But at the same time, it is not a guarantee for lower prices, because if the market efficiencies are able to work on the markups, then there's a bit more competition. But that is another access factor to consider. In terms of awareness, we've heard many of our speakers today talk about, awareness and education and people living with diabetes knowing about the right frequency of testing depending on their diabetes status. This addresses the issue of fragmentation of demand. So addressing low awareness and weak testing habits, as well as providing training and health system support, will allow for a healthier market and healthier demand generation. Acceptability. All our speakers spoke about this as well today. The quality standards have allowed them to be able to present products on the markets that are of comparable quality. And there also has then to be additional work that is done with regard to overcoming inherent distrust for local brands. The made in Algeria, made in Nigeria should not be seen as a disadvantage, but the product should be assessed on their performance and their quality levels. And finally, appropriate design. Locally made strips are more impactful when they're integrated into public procurement schemes and when they are routinely reimbursed. And with that, I would like to hand back over to Kathy to handle the Q&A segment of the webinar. Thank you.
Thank you so much, Dide. We've covered a lot of ground. I'm sure that you'll agree with me, from the lived experience perspective to technical feasibility, policy changes. And thank you. We've received some questions in the chat. If you would like to send some more questions, we may have a couple more minutes. But it's an opportunity to engage with our panelists. I'm going to start with the first question that came through, Mary, and it's to you, actually. And the question to you, Mary, is what percentage of demand is filled with Codex strips locally, if that's something that you would like to answer?
Okay, thank you so much for the question from the chat room. So, well, I think the easiest way to answer the question is to say very, very small percentage. I already mentioned during the introduction that from inception to date, we've only been able to sell about 500,000 packs of strips. So that is really small compared to the estimated market demand, which we find to be between 8 to 12 million packs of strip is what the market should be able to afford. And this is why for us, there needs to be more awareness. And at the moment, we're working with the federal government to do a national screening where we hope to reach about 4 million Nigerians. And following the screening, a good number of them, about 100,000 of them will be getting the glucometers for free. So this is another way the government is, stepping in to support this local manufacturing project that we've embarked on. But despite the government's support, with the about 200,000 strips that have been supplied, the market share, we're still very, very low. We are hoping that following this national screening project, it can dovetail into some national health insurance considerations for the diabetic patients, where some of the policies we see in Algeria can now be implemented in Nigeria, and patients can get the benefit. And with more of that awareness going out, we can have more people buy the product and increase our sales. On a final note, I will say that in Nigeria, a lot of people in the middle class, and this is for me another consideration where I feel the private sector has a huge role to play, because there are a lot of people in our market who can afford the products, but they are not aware of their diabetic status, whether they have diabetes or not. And we find out, there are a lot of them. A lot of people who present in the hospitals present when they already have chronic symptoms of diabetes. And for many of them, it's, getting to the tail end of, the progression of the disease. So we feel that with more awareness, such as this national screening project, and more conversations like we're having here today, and the people knowing more about diabetes and why it is important to test regularly, whether you've been diagnosed or not, we can have those numbers go up, both in the public and in the private sector. Thank you.
Thank you so much, Mary. I now have another question that's come through that I'm going to actually ask each of the panelists to address each of the manufacturers. The question is talking about strip quality. Are your test strips meeting the ISO 15197 criteria or potentially other locally applicable standards for strip quality? Perhaps if you would like to comment on that, I'm going to ask Zubia, would you like to respond first?
Yes, it did. As I said, we have conducted 2 clinical studies in 2021 and 2022, and the first one was in real life, and the second one was done in ISO 15197 standards completely. This is to respond, and we also have certification of GMP in our factory, and we are working since 18 months. Now I hope we will get it by the end of the year. We will get the CE mark for our strips. That will be open the way for export our product worldwide, but mainly in Africa, I think.
Thank you, Zubia. That's very, very promising and encouraging responses there. Erwin, from your perspective.
Yes, thank you. Yeah, the answer is yes. We do design our strips and our manufacturing to meet ISO 15197 standards. That's mainly because we do a technology transfer and our technology partner has set it up that way. And we're also in the process of trying to get the CE certification. Although I would like to highlight that the Indonesian Ministry of Health do not require that to register a product in Indonesia. Instead, what they have imposed is that a requirement to do a clinical trial with a comparison to a golden reference. So that's what's in place right now. But to answer your questions, yes, in our particular manufacturing, we do compliant to that ISO standard.
Thanks, Erwin. And Mary, for Codex?
Yeah, thank you, Kathy. So yes, I would align partially with Erwin. Because it's technology transfer, the products do meet the ISO 15197 standard. However, as I mentioned earlier, we have done several validations of this product in some certified laboratories and in federal health facilities. Over 40 facilities have validated our brand. And in a very good number, the very top facilities, I think about 3 or 4 of them, validated our brand using the ISO 15197 standard. And it is based on that validation that they adopted the brand in those facilities. Now, in addition to all of this, we are looking at exploring the CE marking of this brand. We are actively working towards that at the moment. Particularly because we are looking at the potential for exports. In Nigeria, I think NAFDAC registration and NAFDAC's own certification of the product should be sufficient, but we've added on to that on our own the ISO 13485 as an additional statement of quality, and we validated the product against the ISO 15197 standard. Thank you.
If I can add just something about the standards, I think the best way to compete there and to prove the quality is to conduct clinical study, and the best is to publish this clinical result of this clinical studies in international scientific magazine. That will really help, and that really helped us in the last years to convince physicians and prescribers that this is the very good quality of product, similar to the multinationals.
Thank you, Zubia. And Anita, just bringing you in here, I think from a diabetes community perspective, how do we go about building trust in local brands? What's important for you?
Well, of course, we need policies that guarantee the accuracy, the quality, universal, affordable, and consistent access to glucose strips, recognizing that glucose strips is not a luxury, it's a life-saving necessity. So I think we need to, all of us work together to achieve the goals.
Thank you, Anita. And I'm going to address one last question that came through in the chat. And the question was, how does FIND see the impact of WHO pre-qualification on the price of glucose test strips to the end users? I will respond, of course, Bashir from WHO as well, but at FIND, we see WHO pre-qualification as an important lever to improve the quality assurance, as we've spoken about just now, and market confidence, which can indirectly influence the end user price in several ways. So it's not a direct price control mechanism. But we've heard in the webinar today that in many LMIC markets, one of the reasons glucose test strips remain expensive is due to the limited trust in locally produced or lesser known products. And WHO pre-qualification creates a globally recognized independent validation of product quality. And over time, this can reduce the trust premium, I guess, that's currently embedded in the prices currently in the markets. It also, pre-qualification also allows procurement agencies, donors, and governments to confidently include newer or local manufacturers in pooled procurement mechanisms. And while we recognize that WHO pre-qualification, it requires quite a considerable upfront investment by manufacturers, in terms of documentation and testing and quality. Over time, it could reduce the duplicative regulatory hurdles across countries, which we've heard described by the panelists as well. So I think in summary from FIND, pre-qualification, it is not a price control tool in itself, but it strengthens market confidence. It can expand supplier eligibility, enabling pooled procurement and reducing duplicative regulatory costs. And in that way, it can contribute to more competitive pricing and better affordability to end users over time. We are up for time, and we thought we were going to be over time because of this topic. We do have one final Mentimeter, perhaps. If you would like to engage with that, I'm going to ask the team to move to the next screen, please. I don't have control of the screen. And it's a Mentimeter with a final question to the audience, to the participants. While it is coming up, we will be, I wonder, Sarah, maybe let me hand to you while the Menti is coming up.
Yes.
If you'd like to share some closing remarks.
Yes, I'll do so. They're the Menti, but I can speak while people, if we can start the Menti, I can do the closing remarks while the answers are coming up. I think also there's a certain lag between us putting this question up and people answering, so we'll give more time for the audience to answer. As Kathy just said, we had a very interesting topic, and I know we're on time, so we try to be as short as possible. We've had a very insightful discussion on the feasibility, economics, and impact of local blood glucose monitoring strip production. And based on the valuable input from all our speakers, it is clear that local manufacturing of test strips have the potential to improve affordability and availability, but also to foster innovation and economic growth within the communities and within the countries. And I think that also goes back to what Bashir mentioned as being part of the operational framework for access based on the WHO work. However, changes across local manufacturing policies, diabetes management policies, healthcare coverage, and advocacy are essential to increase the demand and make these efforts sustainable. Therefore, if local manufacturing is pursued, demand generation should be supplemented or even preceded by interventions that both accelerate the entry of quality assured local products and also drive demand towards them, so that we can ensure that if people in companies invest in setting up these facilities, these products really reach the population in the local setting. Because that's coming back to what Anita mentioned in the beginning. The reason we're having all this discussion is to ensure that the people in need get access to these essential tools. And seeing on the screen, we talk about, it's interesting to see when you talk about complete the sentence, local manufacturing of glucose strips will succeed when we talk about them being affordable, accurate, And we have a lot of other items, as we have covered today, about government policies, supply is consistent, trust in the product quality. So it seems like, also based on your experience, it seems to align very well with the discussion that we've had today. So it will be interesting to work towards this, to work on making these products more affordable and ensuring that they're made available locally. So with that, I would just like to mention two last things. If we can move to the next slide. The full report of our work is now accessible on our website, that you can access either through a QR code that should come up on the screen shortly. We will also share the link in the chat, or you will also be able to find it by connecting on FIND's NCD webpage. And to close the session, I really want to thank the full FIND team for making this happen, to all our speakers for sharing their experience, their learning so openly with us, and to each one of you in the audience for being part of this important conversation. And I think together we will work on addressing these items and making sure that the patients get better access to test strips. Thank you, everyone, and have a great day. And there we have the report with the QR code. There was some delay, but you have it now. Thank you, everyone.